So good afternoon again. My name is Caroline Paré. I'm going to moderate the first panel, a quick presentation. I'm journalist at Radio France Internationale, and I moderate the Priorité Santé program. And I'm very happy to be here. This topic is something we broach regularly in our program because we mainly work on southern countries and Africa mainly. So we talk about this on a daily basis, and it's important to talk about this because of the summit in Paris. And so for this first conference, the theme is how to improve and secure the RUTF. A lot of people know about this topic, but we'll have to explain things further, and we need to recall the origin, the utility, the shortcomings on this topic. We have to keep repeating the messages so that they might be understood. Although for many of you here, fighting against malnutrition, and especially child malnutrition, is obvious. Well, in the public health policies, there's still a lot to be done in terms of advocacy to convince all the different players in terms of funding, in terms of organization, and in terms of discourses to communities to convey the messages, etc. So we will be discussing with all our speakers here on the panel. Now, this discussion will be in French and in English for simultaneous interpretation. You have to click on the globe at the bottom of your screen because a lot of the people are connected online with us. They're behind their screens and they're going to follow our discussion. So to choose your language for those who are online, you can send your questions through the QR button. And for those present here, there will be a Q&A session at the end. So if you want to keep your questions, there will be a dedicated moment at the end of this presentation for your questions. Now, to go back to our main topic, we'll be talking about the funding of these ready-to-use therapeutic foods, the safety of supply, because today there is a lot of proof on the usefulness, the relevance, the efficiency of all these systems. But there's another observation is that it is insufficient, and some people feel powerless, especially the caregivers, people who are directly involved, the families of the beneficiaries. They do not have the means to have access the time, whatever the state of the child, to all these products that are indispensable. Just to give you a figure, out of the 19 million children concerned by malnutrition, by acute malnutrition, half have access to treatment, less than half. And to understand all this, we're going to give the floor to Dr. Rodrigue Alitanu, who is Director of Operations at Alima, the International Medical Action NGO. Alima works in 13 countries, especially in Western Africa and Central Africa, and the Alima is the coordinator of this session. You have the floor. Good afternoon. Ladies and gentlemen, distinguished guests online and in presence here in this room, I would like to wish you a warm welcome to the Atelier de France. My name is Rodrigue Alitanu. I am a physician and director of operations of the Medical Action Alima, whose head office is based in Dakar in Senegal. Thank you for joining us for this event. And we would like to obtain solutions to facilitate the management of children suffering from severe acute malnutrition and save lives in this way. You know, as a physician, as Madame Paris said, I've spent more than 10 years in the field in Western Africa, in Central Africa, in countries where malnutrition is a real scourge. As a practitioner, I've seen and taken care of children that were too weak even to cry. And as a hospital manager, I've seen whole families that were powerless. They couldn't do anything while their children were suffering. Malnutrition, it's been decades that we've been hearing about it. And we feel that nothing is happening, nothing is moving forward. It's been years now that we're trying to find solutions so that we can pursue our programs. And we are wondering whether we can really eradicate malnutrition. Unfortunately, that's the question we're still asking ourselves. For us at Alima, and this is the case of several operational people here in this room, our teams in the field see children every day suffering from severe malnutrition. And when we take care of them properly, day after day, and some of them do get well, are cured, then we understand that we can't give up. We cannot give up. In 2025, more than 90 million children will suffer from acute malnutrition and might even die because of that. Half of them, that is two-thirds of them will not have enough treatment. They will not have the adapted food. Two-thirds of them will not have access to treatment because there will be a lack of funding for us to continue the project, so we know how to take care of them. You know these little white packets, red and white, the ready-to-use therapeutic foods, they are recognized by the WHO as an essential medication, but where are they? Where are they? Each week, as the manager of operations, almost every day, our medical teams tell me that quarter of Nigeria, Dakoro, we don't have enough of these RUTF in storage. We don't have enough supplies. We don't have any more boxes of RUTF. And we have to send children back home without being treated in the northwest of Nigeria. We won't be able to take care of children in 2 months from now. 2 months, and that will be during the malnutrition peak. And since last year, in Chad and in Niger, the authorities came back to us that we diminish the dose per children because of the lack of availability of this food. And this is unacceptable. This is unacceptable because we cannot help these children who are so fragile. And we are forced to send them back home, knowing fully well that they are condemned. And this is unacceptable. It is regrettable, but we do it because we have no other choice. The teams are tired, they're fed up of searching for boxes of RUTF in the field. And these shortages, chronic shortages, are due to supply issues, but also because of lack of funding. Why is this funding insufficient? Because today we know that funding malnutrition is based on humanitarian help. which is undersized, and we're at the mercy of politicians, as we've seen lately. And this model, we know that it is not adapted. We have to be aware of this, especially with this public health issue that requires long-term public funding that is equitable and sustainable. We are physicians, we are logisticians, we are people working in the field. It's not up to us to invent the new mechanisms of international funding. It's up to us to warn people that it is urgent to do something about this. I'd like to thank you for being here. I'd like to thank the panelists who are going to talk about this. They're all experts. I'd like to thank all those present who are going to contribute to these discussions. And I'd like to thank Mrs. Parry, who is going to host this session. Thank you very much. So we later on for the Q&A session. The different points you've mentioned, this is an introduction, it's also summary, and you've said several things, and one word you've repeated several times, intolerable. Intolerable, so how can we find solutions? So we're going to be developing all these points. So there were 4 panelists first. The representative from Nigeria could not join us here in Paris. She had flight issues, so she is excused. Now, before the first questions, we have Isabelle de Fourny. I suppose you all know her. She's the president of MSF France. She was in charge of nutritional projects in Niger from 2005 onwards, so she's right here. To represent UNICEF, we have a key player, because MSF, that is 80% of the global requirement for RUTF. Then we have Sal Guerrero. Check if your microphones work well. You are a senior advisor to finance child nutrition and development at the UNICEF, and we'll be talking about the means to strengthen this fund for nutrition. You will tell us what this is all about. And the other panelist is Navid Akbar. You are the Director General for Cash Transfer for the support of the Benazir program. You will tell us what this is all about later on. And if you don't mind, we'll begin with you, Isabelle Dufourny. Just to tell you about your background, I know that a lot of people really know here in this room there are people at the top of companies who've invented all this. So the RUTF, the ready-to-use therapeutic foods, to be useful for decades now. It's an essential medication to take care of severe acute malnutrition. And here we're talking about a class of children, which is key in terms of vulnerability and lifetime, because it's the time of growth of these children. You have to be very careful. Yes, good afternoon. Yes, absolutely. The arrival in the field in the years 2000 of these ready-to-use therapeutic foods, this created a revolution to manage severe acute malnutrition. In 2 aspects, it drastically improves the medical results, the number of children who are cured, and we can deal with a great number of children. Before the arrival of this medication, severe acute malnutrition required 1 month of hospitalization for young children. The medical results were variable and wasn't a very convenient care model for the families. With the ready-to-use food, most of the children can be taken care of at home. And in 2005, in Niger, dozens of families would come and get the RUTF. From that moment onwards, the number of children managed increased. We had hardly any children, some 100,000 at the beginning of the years 2000, 200,000 in 2005. and more in 2011, 2 million in 2011, and now 9 million. I'd like to add something. Right from 2006 onwards, considering the extraordinary results of these RUTF, right from 2006 onwards, teams of Médecins Sans Frontières used them to deal with moderate acute malnutrition, children suffering from moderate acute malnutrition. Here again, the results were very good. They would recover quickly, and the malnutrition would almost disappear. So we used these RUTFs right from 2007 onwards. We had preventive distribution at the time, and we demonstrated their efficiency, especially based on the mortality rates. And 20 years after today, the number of people managed, of children managed, has increased. And in the world, we see large areas of malnutrition. Often half of the children have growth delays, are stunted, and because of the drop in American funding, but not only because of the drop of funds, the decline in this fund, we're very concerned, and we see it in the field. We are facing situations where we have to prioritize, and why this child and not the other one? There are rations that are diminishing, and even the quality of the rations distributed to the children is going down. It's a great gap between the rationale we have to follow and reality, because what you're telling us is that we are no more in a situation of absolute emergency, humanitarian crisis when the media are present, but this is long term. And we have to consider this, as we said in the introduction, as a real public health issue, a long-term public health issue. Yes, severe acute malnutrition is not just a humanitarian issue. It's a real question of public health. The death of children throughout the world, even today, this is explained, but for half of them because of malnutrition. So we do understand that conflicts, the displacement of populations, as we see it in Gaza and in Sudan, this has created nutritional crises, but it's not just that. In the world today, in some countries, in some regions, in those countries, there are places where the malnutrition rate is very high, where there's the chronic malnutrition, up to 50% of the children, and the acute malnutrition rates, which is added to the chronic malnutrition rate. And in those countries, in those areas, the efforts are long-term efforts, and we'll have to take into account the children affected from moderate and severe acute malnutrition. We'll have to give the families food supplements so that these children can grow in a healthy way, and this requires a political engagement from the states. The states have to commit themselves, and they require funds so that these funds might last in time, and we'll talk about this. The Child Nutrition Fund is an interesting means, an interesting resource. It has to be supplied regularly with innovative funding, like the taxes on sodas that can provide us more money to these funds.
Now, the problem related to funding is something we're going to touch upon later on as well. It's also an issue of availability of products. It's not just a matter of money, but also of production. If you look back at production and availability and funding, we had a peak with the Ukrainian crisis. So we can see that it's also, this issue is also associated with some political crises, some crises that are under the limelight, and that's also are associated with the influx of dollars, $500 million, where channeled, not only for Eastern Europe. There's another peak in news, which is Nigeria. Some regions in Nigeria are faced with an acute problem of malnutrition, severe acute malnutrition. There's yet another example in Pakistan, with the funding mechanisms in the production situation that are such that the solutions can be diverted by some people, and it's also a financial and also a political matter in terms of acceptance of public health policies. So, Isabelle, you gave us a few examples of emergency situations. However, if you take a look at the world today, where are these foods needed, and where are the shortages? Well, a bit everywhere, I'm afraid. In some major humanitarian crises that are not really well known or talked about, such as the in DRC, for instance. We can't manage these children. We can't take care of them properly. It's also the case in major clusters of malnutrition. And according to estimates, we think that there are some 15 such clusters around the world, in particular northwestern Nigeria and in Niger as well. So these RUTFs are also missing from regions where there are children suffering from severe acute malnutrition, but it's not good enough to try and help these children. They are at a stage which is far too advanced. So we need to tackle the problem earlier, upstream. And I was telling you that there are, in some places around the world, some 50% of children that suffer from stunting, because the families can't manage to find the food they need to sustain their children's growth. So in these areas, we really need to supplement the nutrition of these young children. It's a major challenge, and also more particularly areas where population, there are people who are displaced, or when, of course, populations are faced with climate change and global warming, that may lead to food shortages. Let's focus on Pakistan. Navid Akbar, I introduced you earlier on, and I told the audience about the program you belong to, which is the Benazir Income Support Program. Can you tell us more about it?
Thank you very much, first of all, for having me here to share our experience and the contribution towards addressing a very challenging but very important aspect of addressing malnutrition. So to just share a bit country context, Pakistan is a country with 240 million population. We have, according to the multidimensional poverty index, roughly 40% population living below the poverty line. And we carried out a national nutrition survey back in 2018. And according to the national nutrition survey, we have almost 41% children stunted, roughly 17%, 40% stunted, roughly 17% wasted, and around 23% underweights. So with this context, and if we specifically see the bottom two quantiles, which are poorest of the poor, these numbers are quite alarming. Like more than 50% children are stunted in bottom two quantiles. With this background, we thought that there is a role of social protection to address this issue of stunting, because usually the poorest of the poor, we all know that they don't have health as their preference. And also they're also facing issue of affordability, and they are not able to consume the required calories per day. So these are important aspects that we looked into it when we decided to have social protection come in as a source for providing or addressing this issue of malnutrition. So Basic Income Support Program is basically a cash transfer program covering roughly 10 million families receiving regular cash grant, which we call unconditional cash transfer. Women is the recipient of our cash assistance. And we also have conditional cash transfer programs. So the same beneficiaries who are the beneficiary of unconditional cash transfer, if they're sending their children to the school, they're getting extra cash transfer. And the another conditional cash transfer program we have is the conditional cash transfer linked with health and nutrition. So this program was designed back in 2020 with the focus to prevent stunting amongst the beneficiary families, which are basically from the bottom two quintiles. So we are focusing on first 1,000 days of child. It's a comprehensive intervention. We are providing LNS. We are, also verifying the condition of immunization. There is an aspect of social behavior change communication as well, which is linked with the conditionalities. And on achievement of these conditions, we are also providing additional cash transfer, which is basically with the aim to address the issue of affordability so that people can also buy the nutritious food to bridge the gap between their income and expenditure.
So concretely, the mothers or the families do have cards that you charge so that they can turn to distribution centers or to health centers or to other forms of food distribution?
This conditional cash transfer program is a design way that we set up the facility centers all across the country and the health facility and the public health facility, where we are actually enrolling the beneficiaries, those who are falling in this first 1,000 days criteria, starting from pregnancy, then lactating, and then children up to 2 years. So beneficiaries are required to visit these health facilities once in a quarter. So they will have to verify their compliances about their immunization, about the behavior change communication messaging, and also getting the food from the health facility. So we are just giving a 3 months ration of food, this specialized nutritious food, LNS. And they are bringing the empty sachets with them to share the means of verification in order to get the next 3 months ration of SNF. So we have, and we are also providing the cash transfer to cover the transportation costs, which are being incurred to actually reach out to the health facility. And when they are reaching to the health facilities, we're also ensuring antenatal and postnatal care after every 3 months. So we are covering roughly 2.8 million families who are enrolled in this conditional cash transfer health and nutrition program with roughly $200 million budget every year allocated to this program. And since 2020, we actually we spend roughly $500 million for this program, and for next year onwards, the annual budgetary allocation for this program would be $250 million with the intention to cover roughly 3 million families every year through this intervention. So we are very lucky to have the local producer of both LNS in terms of for prevention and for the treatment. And what we are trying to do is that in order to ensure that there should not be any gap between between the first consumption and the subsequent consumption, we are actually procuring the LNS 6 months in advance, and we are basically building up the stocks and making sure that whenever beneficiary are due to come to our center, they should have the supply available with them. Yeah.
All your beneficiaries, however, quite a large part of Pakistan's population and children in Pakistan are not covered by this program and therefore are faced with severe acute malnutrition.
Yeah, so basically, as I mentioned, our main focus is to cover the bottom two quantiles. Obviously, we are a large country. We have a lot of people which we are not able to cover in the program due to the financial constraints. So we basically have two components. One is the health side, so Ministry of Health and Department of Health. So they are taking care of treatment of the children, both SAM and categories, and they have the funding for that as well. And that program of treatment is for everyone, so it's not targeted intervention. But the one that we are managing through a social protection intervention is a targeted intervention for those who are previously poor, and we are trying to actually cover the gap as much as we can. And since we are also probably you know that Pakistan is prone to disaster. We recently faced flood back in 2022. And large number of population actually who are not poor now is basically all falling under the poverty line. So we try to have the horizontal expansion with time, improving and our next year target is actually to cover the third quintile as well in this conditional cash transfer to bridge that gap that we're currently having. And in order to make it sustainable, in order to ensure that we can have more coverage, we're also exploring this child nutrition grant as well. Previously, we were managing the MQLNS, medium quantity supplements, but now we are actually shifting to the SQLNS as well, so that we can, MQLNS is basically 50 grammage, SQLNS is 20 grammage, so we can always save a lot of cost. And we have seen that there is more benefits for SQLNS as compared to MQLNS in order to ensure a full consumption of a sachet. So, so with these changes, we are trying to cover more people in the program in the future as well. Yeah.
Avant de donner la parole à Saul Guerrero.
Before I give the floor to Saul Guerrero, you told us that you have local production, local producers. Can you come back to this point so that you can tell us whether you can cover all your needs with the production in Pakistan, or whether you do have to import some of these RUTFs from other countries?
So basically, yes, we are not only able to cover all our needs, but the producers that we have in Pakistan, they're also importing the product. Yes, we have, although the ingredients that we are using for the local productions being imported, sorry, I said imported, but exported to other countries. We are currently doing that through that supply. And we are also actually working on making this product a commercialized product, so that it should be available in the market. Other than the population we are dealing with, they can also buy it from the market. So that is something that we are working at the moment as a social protection entity to ensure the demand of this product in the market. Yes, but in order to respond to your question, so we have enough supply. As I said, we are buying in advance, 6 to 9 months advance, lining up the funding availability and making sure that that product is available all the time for our beneficiaries.
Et sur l'acceptation
What about the approval of this budget for these products? Is it something that donors, the government accepts, or do you have to go for advocacy, and or do you still have to prove that your distribution system does work?
So the funding source is entirely the government of Pakistan's taxpayers' money. So we do get Development Partners Corporation through loans, but it's again for the budgetary support to the government of Pakistan. But entire budget is basically the taxpayers' money that we are using it on. Basically, the reason for getting this huge funding is the evidence that we generated out of this program and give confidence to the political leadership that, this is something that that can deliver and that can, have impact on the reduction of stunting. And the good thing is that we are carrying out regular effectiveness studies of the program as well. So our midline is almost, is ready to be released. And according to the midline study, there is a significant reduction in the stunting in last 2 years through this intervention. And we designed this program in a way that we started with an operational research. We tested different arms through that operational research. And the arm which was more effective, we tried to then pilot it through a large pilot. We piloted it in 14 districts and then generated evidence out of that. Took that evidence in front of the political leadership, convinced them to have the funding line available for this program, and then scale it all across the country. And now our focus is to have more horizontal expansion, to cover more beneficiaries, and we have a very strong political will for this program and investment, because it's a very important area. We give this realization, and government has actually realized that if we will not address this issue of stunting, we are actually compromising with our future generation, and there will be a huge burden on the economy if we will not address this issue of stunting.
Merci beaucoup. Je me tourne vers vous, Saul Guerrero. On a parlé de
Thank you very much. Sal Guerrero, we've been talking about the evidence, the funding, and the distribution, and the political will. And we've been told that there are also some programs or some plans to extend this throughout the territory. So how can we make sure that funding becomes sustainable for this food? Now, we know that some channels of funding are going to disappear. So how can we come up with new ones when faced with all these clusters of malnutrition? We have all these red dots across the globe. So what's your take on all this at UNICEF? And because you do have the upper hand on several distribution centers, so what can you tell us about this? How can we secure the distribution of this food?
How much do you think you need per year? How much? What's the dollar figure? By RUTF, you need to treat 90% of all the kids in all the places where they're buying from it, if they don't get it. If we don't know that answer, this conversation is pointless. Because if it's $100 conversation, we can solve this tomorrow. If it's as it is, a $1.2 to $1.4 billion a year conversation, this is a really tough conversation. Right? So that's the first thing is, I was in Nigeria in 2005. I understand watching your program last year, amazing. And I also thought that I was just a field person, right? And I thought to myself at some point, but there is enough. And instead of thinking somebody else is planning to figure out the financing instruments, I figured the cavalry is not coming. The solution is not going to come. Nobody's going to solve this problem except the people in this room. Right? And so I tried to inform myself. How much do we need? And the more we have spent time looking into this, the more we have reached the conclusion that it is true that we need 1.4 billion a year, but you need to segment that figure. Some of the places where these products are needed have the fiscal space to pay for it themselves. It's a fact. Some of the countries where the needs are the greatest, and when you're asking, where are these children? 50% of them are not in Africa. So just to get the facts clear, right? Many of them are believed to be in places like Indonesia and Bangladesh or the Philippines, and these places have fiscal space. So we need to begin to segment that amount into the who can pay for it and who cannot. And once you begin to segment, then you can ask amazing people to introduce these products into their national policies and their national budgets. And we can begin to ask ourselves, how do we use the additional resources specifically for those who cannot pay? and there is no credible path to fiscal space in the foreseeable future. Those places, you can count them in the hands that you have in this body.
We're not talking about 50 or 100 countries. We're
Talking about a dozen countries where there is
no path
to fiscal space.
What we haven't done as a community enough up until now, but now it will become mission critical, is ask ourselves the question, how do we incentivize a national government to choose those little sachets over everything else they have to buy? Right? What is the reason why they would choose this? You could say, what about the children? But everybody says that. About something else, about vaccinations, about education. It's not enough. But they're going to die. Yes, they're going to die of a million other things too. So the argument cannot be that. Right? The incentive has to be real and sophisticated. So what we began to do was to say, well, what if we said, we will match whatever you put. If you put $1 million, we'll give you $1 million. Would that incentivize it? Would they shift budgets, national budgets, to do that if that was the incentive? Over the last 18 months, we have transferred 30 million to these countries on that basis, meaning that we have pumped $60 million into the ecosystem for RUTF on that very basis alone. It's not 1.4 billion, but we got to start somewhere. So the question of where does the funding come from begins with understanding where is the need and whose responsibility is it to find that money. Can they meet that responsibility? Sometimes the answer is yes, and therefore you need to introduce incentives to make that happen. And in some contexts, the answer is no. And therefore you need to aggregate all of the little funding that continues to flow from a global level into these places where if we don't do that, there's a high risk that children will die from it. So my answer to you is there is more out there than you realize, but we gotta work for it, like everybody else.
La question du financement, mais aussi la question des pénuries.
There's a question of funding and the frequent shortages. So there's a dual rationale to obtain the funds and to obtain stocks of products. So how can we work on both sides at the same time?
Two fun facts I discovered in the last 6 years at UNICEF. When everybody thinks that the UN somehow is not like an NGO, let me break it to you, we're exactly in the same situation. We have no idea what we're going to get next year. That's, you think that somehow we have this magic pot where we don't. And that means that financing RUTF is literally like playing Tetris. You start the game not knowing what's the next piece that is going to fall. You have no idea. And as the game progresses, the stress becomes harder because it's becoming faster and faster, and things are sucking up on this holes, and the things become like this every single year. Things break because we can't see either the pieces drop too fast, right? Or they're just impossible to place in the position where they were meant to be placed because of the way it works. We need to stop this game. The answer to the solution to the stockouts is not that there are enough pieces to fill the whole picture. It's that they cannot fold the way they do. They can't. The answer, in our opinion, more and more is we need a stabilization measure that allows us to, at the beginning of the year, issue purchase orders for an X amount for every country where we know it's going to be needed, and we collect them over the course of the year. From different programs. Otherwise, this is never going to happen. Otherwise, on March, we might get a grant from one donor. In May, we might get another one. Then 15 days later, we might get another one. This is a way to do this sustainably. For that to happen, we need money. The only way you can build a stabilization fund is with money. But it's essentially a revolving fund. And it's kind of crazy that after all these years since Andre had the brilliant idea that got us here, by the way, demand the legend, please. It's crazy that we haven't given the man as a revolving fund so that the thing that he got put into this world can actually flow properly. So that is where we need to start moving towards, is something where, because until we do that, it isn't going to be, it's easy to think that it's a supply chain management challenge, but it isn't. It's a money problem. And the way money flows.
not only how much,
how it flows.
and we can break that.
Ça veut dire que quand l'argent sera là,
That means that when the money will be there,
les barres seront là elles aussi, les barres nutritionnelles.
the nutritional bars will be there too. Is it just a question of money?
Well, everybody in this room is going to crucify me when I walk away because I'm going to say yes.
Maybe
15 years ago, you could say it wasn't. There are 22 manufacturers of RUTF today around the world. Most of them will tell you, and I think I saw someone, raise your hand if you make RUTF.
There we go. Most of them would probably agree with me that they have spare production capacity right now. Right? So it isn't the production capability, it's the visibility of the funding that prevents them from optimizing the existing capability.
15 years ago,
we were a wonderful factory not too far from here.
Today, we can find those factories 50 kilometers away from the site where the product will be used. So it's not just money. That's every person on the planet will tell you about every issue. Money does make the solution a lot easier to implement.
Maintenant, si vous dites,
But now, if you say, who, from the financial point of view, can finance or the producers can produce, would as many people raise their hands? Where can we find the money to run the plants and produce more of these RUTFs? We were talking about this soda tax. What more can we do to go from projects to reality?
The problem with taxation is that you cannot force a government to do with the taxation what you want. People invest their taxes how they want. And it's wonderful that we have these ideas, and it's true, we should absolutely be taxing soda, by the way, and sugar subsidies, and all sorts of things. But I think the idea that we can link that income specifically with something, most people who know this, and I'm not one of them, but most people who know this assure me that this is not really that easy to do. So what we have done, because it's the only thing we can do, is to create a vehicle, like the Child Nutrition Fund, that tries to do two things simultaneously. One is to turn to countries like the government of Pakistan and say, what can we do to help you on your own journey? You said it, spare dollars, fund their program. But is there anything we can do to facilitate that journey? And I'll give you an example. Some countries will say, I want to get there, but for the next 2 budget cycles, I can't. My product is not in the pharmacy list, and I cannot put it. There's no budget code for RUTF in my budget.
But it will take me 24 months
to do it. We can say in the Child Nutrition Fund, I'll cover it for 24 months, but in year 3, you are covering it. And by year 5, I'm paying zero.
And you're paying it all. You can't do that. But again, you need a vehicle
to do that,
which is why we created
the CNN. And for those countries where that conversation is just right now is not possible, it's a place where we can say to donors, to the few donors that still believe that this is worth investing their money, put it in a place where we can make sure that it will be allocated
where the needs are greatest and in the most complementary way possible, and giving us
the freedom to be dynamic enough to pay Tetris in slow motion.
on va donner la parole si vous voulez bien. On va donner la parole si vous
So we need to give the floor, if you don't mind. We talked about the producers among the people who raised their hands. Abdul Kader Yumli, could you please stand up so that we can see you when you talk? Because we're going to talk about some very down-to-earth things. You are the General Director of NutriCare in Nigeria. Can you describe the nature of your production in your company? So NutriCare, we are from the Plan-Field network. In the past 4 years, we've begun our production in Nigeria, and we are 3 producers in Nigeria. It's one of the only countries in Africa that has 3 producers, and we produce to cover local demand in Nigeria and to cover the sub-Saharan regions. The countries close by. That's where we suffer most from now, malnutrition, Niger, Cameroon, and Chad, and a small part of Sahel. Do you have sufficient production to cover all the needs? Or in this particular zone where the situation is particularly alarming, do you also import food from other regions in the world? So our production could cover all the demand from Nigeria and the neighboring countries. We do import also because it's a question of competitiveness. When we talk about competitiveness, that means price. And the local producers sometimes we believe are more expensive than the ones coming from elsewhere. It is true when we look at the price of a box. But when you look at the entire value chain, it is different. I suppose that you work with farmers, local farmers. Yes. Yes, I'm speaking on behalf of the others too. Yes, we have the peanut line. We use local peanut production. We also have sugar packaging coming from Western Africa. And so does that mean that you are vulnerable to the market fluctuations for raw materials? Yes, absolutely. So after the COVID, the cost of raw material really increased, especially dairy products. There was a strong increase in the price of those products, and this impacted the children that could be treated. And in the meantime, in the past 2 years, the prices have gone down again. This was felt on the end product, and the UNICEF and MSF can testify this. Are you planning to grow, to have other factories? Well, we have enough capacity to cover demand right now. There's just one issue. We need to increase our number of sites. We need to have more orders, and we need to have the funding to cover the demand. And as for your relations, because earlier on we heard about Pakistan, which is really engaged, what are your direct relationships with the Nigerian federal government? This is a very complex territory for various reasons. How do you deal with them? How do you work in this very complex context? Yes, Nigeria is slightly different from the others because we're lucky we have 3 producers. We have the federal state and we have the federal governments that are different. The federal state places orders as well as the governments. And in the last 2 years, they use these matching funds. They have a budget, and with the UNICEF, they place some of their orders and we have the volume. So this is how it works theoretically. In reality, it is more complex between the budgets they allocate and the orders. It's another story. But overall, I could say that UNICEF, MSF, and the others, in terms, if just for Nigeria, they've bought more than 95% of their needs from local producers. This means that this creates local jobs. Yes, it creates added value and it benefits everyone. And the same population suffering from malnutrition, where the children suffer from malnutrition, these are the people who work in farms. Peanuts, for example. We have a virtuous circle because the mother, the father who have a child who is suffering from malnutrition, if they can grow peanuts, they could be one of the suppliers that could give us the peanut to treat these children suffering from malnutrition. The more we produce locally, the more we have a value chain that is developing. Now, doesn't it mean that it removes production from the local market to go into your production chains rather than going straight to the markets and the villages and to the families? Well, no, not really, because the need for raw material allows us to cover local demand and industrial demand. So now we've reached the Q&A session, if you don't mind. Questions that can be addressed to our panelists, but also to Dr. Rodrigue Alitanu, who's also here, who has a microphone. I do not know Who would like to put the first question,
un point de vue
or who would like to make a comment first?
pour les personnes qui s'expriment, je veux dire
For those taking the floor, please introduce yourself and tell us to whom you'd like to address your question.
Everybody, Will Moore. I'm the CEO of the Eleanor Crook Foundation. Big thanks to our panelists. I think it's been a really thoughtful conversation so far. Just a few thoughts that I'd love to get your responses to. First of all, I thought it was surprising that so far in this conversation, we haven't heard any mention of the fact that we achieved really historic success on the scale up of RUTF just a couple of years ago. The Eleanor Crook Foundation worked together with the Children's Investment Fund Foundation and UNICEF and USAID. And in just a matter of months, we're able to raise over $500 million to scale up our UTF. And according to UNICEF, that resulted very quickly in going from 20%, 25% coverage globally to 73% coverage last year, which UNICEF is saying the 1 million lives saved just last year from that scale up. So I think we should be talking more about that success. It's not like we've just been plodding along and doing nothing. And success can breed success. We can tell donors, this is a thing that's proven to work. You put money in, you get lives saved out at a very reasonable cost. And just two other observations, I guess, in terms of obstacles. I mean, obstacles to financing, which I agree with Saul, that is, money is the big problem. The big one of the big two is, of course, the global environment, and it's tough, and there's nothing we can do about that. But I think the other obstacle that we don't talk about but is real, and maybe the biggest obstacle, is frankly opposition to RUTF funding from within the nutrition community and within the development community. And I do think there is a pervasive notion that a dollar that goes to treatment is a dollar wasted, that it's a Band-Aid solution and we need to be shifting more upstream to prevention. And I think that's a really morally tenuous position, essentially saying we should let children die now in order to help other children in the future. We'd never say it about malaria treatment. We never say it, in the US about treating opioid addiction with Narcan, let them die, let's spend all the money on treatment. But that's what a lot of people in our community say, and I think we need to be calling them on that. And frankly, I've been meeting with development ministers for several years now in Europe and trying to talk them into funding RUTF alongside our foundation. And that's what I hear from every single one of them, that they hear from their teams and from the NGOs that they support, that RUTF is a Band-Aid solution and they want to focus on prevention.
Est-ce que l'un d'entre vous veut réagir à ce qui vient d'être dit d'abord sur
Anyone would like to comment on what has just been said? Firstly, on the success obtained with the RUTF. This is what Isabelle de Fourny told us in her introduction about the history of these projects. And what about this political take on this, saying, according to which, that we need to do more for the upstream food chain instead of coming up with these products presented as a drug? And of course, no one would argue that you should stop giving drugs to people who are sick.
On the successes, I agree, Will. And I think the reason why I'm so categorical about saying money will lead to results, or we are not achieving results because of money, is because when we have had injections of money, we have translated them into results on a very tight timeline. So it suggests that what the system needs is an injection of cash on a permanent basis, not these surges. But I think you're right as well about the fact that we need to demonstrate or to build on what it took for that, right? Like that alignment between individuals and the role that people like Sam Powers played during that period, not to take anything away from you or Sif, but the point is, when politicians decided that this was the thing that they were going to do, amazing things did happen, right? So I think it speaks to your second point, which is the political perspective on this. It's true that I don't think that in order to be pro-prevention, you need to be anti-treatment. Like, we should surely be able to walk and chew gum at the same time. I think there is, ironically, a perception that I think drives a lot of that, that somehow this community has been too treatment heavy. And so it's like an overcompensation. But that overcompensation was easier to sustain when it was a time of plenty. And you could say, let's balance it out. Right now, it's not a time of plenty. And so now we go back to the hard questions that we asked ourselves 20 years ago, which is, if you had very limited money to do stuff, what would you do? And so it brings us back to the question of, can you really make the case for disinvesting in treatment? And I think that's a really hard case to make. But I also think it's really important that we ask ourselves, what does a unified narrative look like? At a time when everybody on everything is convincing you that it's either black or white, like, now is the time to say, well, how about gray? What does treatment plus mean? Right? Isn't there 2 or 3 things that you can bundle in the same service so that the siblings of the kid who is malnourished and needs treatment, and therefore comes from a vulnerable household, can get in a hyper-targeted way that it's going to make it count? Speaking to your SQL&S point and the like, there are things. And so I would encourage those of you who feel very passionate about prevention to continue to feel passionate about prevention, but to be really specific about how we do prevention. And that as you do it, that you try to figure out or work with those who are very passionate about treatment, about whether there is a singularity there between what you want and what they want, and what is the best possible package to give a child.
Je peux ajouter un mot?
Isabelle de Fourny.
Un élément très positif aussi.
There's one thing which is really very positive in showing the results of treating malnutrition, which is the drop in the mortality rate in many countries, not only associated with delivering therapeutic food, nutritional product, but which did contribute to the drop in mortality. This is the case in Niger. Mortality rate in the infant and youngsters were halved over a 15 years period. However, there are still 400,000 severe acute malnourished children who are treated every year. And you can see that no healthcare system in the world can absorb this burden every year. When I was last in Niger a few years ago, I could see young mothers, and I met with them, and they were 18 years old, and they had always been treated with food for severe acute malnutrition. And it's a sort of natural course in the lives of children. Each one of them gets pumped nuts in the course of their young lives. So we need to do better than that.
There is no second opinion on the importance of having this treatment aspect and financing, and rather, I think we should go further ahead to not let our children reach to the treatment stage and focus more on the prevention side. But I think we have to see the problems of the governments as well, especially for developing and underdeveloping countries. So we need to tell them the local solutions. We need to tell them how we can, best produce this product within the country, because government have a lot of areas to look at into. It's not only social protection, it's not only health, it's not only nutrition. There are a lot of other areas that they need to focus on, and they have very limited revenue resources. So probably, I think if we can, and this is our experience from Pakistan as well, if we can convince the government with some local, cost-effective, sustainable solutions, probably that will resolve the issue of attention of the government. And they will definitely invest in that area, because, as you rightly pointed out, the governments are already investing a lot in the health sector, addressing malaria. They put a lot of money for this COVID and vaccination and all those things. Why would they not do it to address this issue of stunting and malnutrition when they are seeing their children are dying? and there is a political pressure on that. But I think problem is to have some kind of affordable solution for the government to sustain that investment.
Une autre question?
Someone else? Marine Vignon, à Lima.
La discussion a été suivie par beaucoup de personnes.
Many people are listening to us online, and there are two questions from Mali and Chad, which I think we can take together. What sort of approach can be applied by the international partners to support countries such as Burkina or Niger, where there is a shortage, just like in Nigeria? And what is going to be the impact of stopping USAID's fund to provide these populations with RUTFs? So two areas with a major crisis in Burkina Faso. On top of that, the political situation, the security-related situation are very complex, and the last mile is very difficult in this country to reach out the population. I think Médecins Sans Frontières are still present in this country, so maybe Isabelle could share their opinion on that. With regard to USAID, the impact, it's very difficult to have visibility and give an answer. Now, my first point is to say that, well, luckily MSF are not affected by the fact that institutional donors are stopping their support. So we will go on with our action as long as we can, though it has become increasingly difficult to work with various governments. And obviously, our remaining in the countries depend very much on the government's acceptance. And for these two countries, well, we know that malnutrition is still very widespread, with permanent crisis, as it were. And these are top priorities, so we're very worried. And I don't know what the future will be. However, we will go on with our work. UNICEF are still present. There are still some partners present in these countries, and we will, of course, explore every opportunity to work with the country's governments. Saul Guerrero, anything to add for UNICEF? There is also Haiti, where malnutrition is absolutely catastrophic. It's structural. It's very difficult to help these people in Haiti. And Sudan also shouldn't be forgotten. It's one of the worst situations in the world, and it's extremely difficult to work in Sudan. And it's also very difficult to get sufficient food to be distributed in Sudan.
Not much to add, other than to concur that if we had to focus our energy in mobilizing resources right now, the countries you just touched on definitely make our list. And that shouldn't be underestimated. It's really important that right now, whether it's MSF or whether it's UNICEF, that when somebody asks the question, where should we be putting our energy, because there's just no other way to deal with the situation, that the answer is broadly the same. Because you'll be amazed how often it isn't. And so if we can stay focused on a few countries, like the ones that have been referenced, and we can make that the focus of our collective and individual advocacy, then I'm pretty confident that whatever remains of global charity, right, and can be mobilized to continue to support that. And we're seeing it both in Burkina Faso. There's some investments that will be made in the next few weeks from the Child Nutrition Fund, specifically in Burkina Faso. We have a team today in Chad precisely assessing the question of operational capability. Our Deputy Executive Director was in Haiti on Thursday last week. There's a commitment to these countries, and I think that there is a realization that we need to prioritize these contexts over many other, but we just need to hold the line
and not be distracted by the next challenge, but to stay the course because they need us to.
Est-ce qu'il y a encore... Oui, madame, je vous en prie.
Oui, bonjour, je m'appelle Blanche Matin.
My name is Blanche Materne, technical advisor for public health at the French Red Cross in charge of nutrition. We've been told about the financing, also the initiatives such as Nurture in Burkina Faso or Niger, where the situation is tragic. Production units was shut down in Niamey. There are also problems about how we can transport products from one country to the next. The French Red Cross held discussions with Burkina Faso. However, we were not able to deliver the products because of the inability to cross the frontier, the border. I'm based in Dakar, and we tried to advocate and argue our case as an NGO on the difficulty to move products around in Sahel, and some discussions are still underway. And I must say that we're faced with, with the inability to do so. So considering the international situation, the international landscape where countries don't want to talk to one another, who can be the partner who supports initiatives such as Nurture and who can argue our case? Because we do have products available. We do have people who can buy these products, because not everyone is impacted by USAID cuts, but we can't move these products around. And it's not just like in Pakistan or where you can really distribute these products. And there are also taxation problems. So I'm sorry, but what maybe it's a bit contentious, but what does UNICEF about all this? And what can we do about all this?
The only thing that I can say is that when you leave that room, we come into that room. And before you came into that room, we were in that room before, as in the same things the Red Cross is doing are the same things the UN are doing, right? Is to try to negotiate access, to try to make the case that on some of these issues, we need to go over and above the pervasive politics but the reality, and I think that is, I guess what I'm trying to say is not a function of trying, it's a function that some things cannot be unlocked. And it doesn't matter who is the interlocutor, it doesn't matter how high up you go, because sovereignty is sovereignty. Whether we like it or not, that's true in France and it's true in Niger. And the decision ultimately rests with the national authorities. All we can do is the same thing you're doing, is to offer time-bound, specific, under-the-radar solutions that will be discreet and not create noise politically, if that makes a difference. But at the end of the day, we get very often the same answers you get, and that's kind of why we are where we are.
Hi, my name's Charlotte Wright. I'm from Glasgow University, and I'm one of the nutrition community who's pushing back. I apologise. RUTF is an amazing product, and it's amazingly effective for its core indication of severe SAM. The problem is mission creep. It's being used for everything. I mean, I'm hearing people talking about using it to prevent stunting, but it doesn't prevent stunting. I've just been reviewing the systematic reviews on this, and once you have that mission creep and you extend outwards beyond that core business, efficacy is appallingly thin, limited, and almost certainly affected by publication bias, because one hears all the time about unpublished null trials that haven't come out to be seen at all. If you want RUTF to be successful, you've got to be clear who it's for and not just give it out like peanuts to all and sundry, where there are much simpler, much more sustainable, much more valid approaches for things like MAM, for rehabilitation of SAM. You've got to have it, it's got its place, it's wonderful, but it isn't a cure-all.
C'était un point de vue, pas une question, mais ça me rappelle quand même une question. Dans ce cas-là,
it's not really a question, but more of a comment. So turning to you, Isabelle de Fourny, if you're in a health center with a mother, with a child with MAM, so if I understood this lady correctly, you would tell the mother, sorry, nothing doing and nothing going, go back home. No, the solution is not a panacea. Obviously, it's not a miracle solution. Maybe it's a Band-Aid, but at least, well, with this Band-Aid, the child can survive, and it's not exactly what was said. But it's true that this category of RUTF with different composition, I don't share your point of view. I don't have the same experience, and neither have I read the papers explaining what you said. I think it would be valuable to have just one treatment for treating SAM. And the treatment for SAM works very well on MAM. It has been shown several times. Now, of course, we can try and use it less liberally in order to save money. However, SAM treatment works well, or there's also going to be something on simplified strategies. And in some areas, in some fields, we do need the LNS. We need ready-to-use food in order to supplement, in order to strengthen the family's diet, also to supplement some local flours. Because in some areas in the world, you can't find enough food in order to prevent malnutrition and guarantee a healthy growth in children. So in some places without LNS, and it doesn't mean, of course, that I'm saying that flours produced locally are no good at all, but all I'm saying that a lot of nutritionists, such as Professor Kedo, have shown the efficacy of these foods on different forms of malnutrition. And well, the experts, I'm not an expert, but the expert is going to provide you with an answer.
My name is André Briand. I know a bit about RUTFs. I think that there's a deaf dialogue because what Charlotte said is absolutely right. RUTF is not a treatment that works for stunting. RUTF is meant for children with severe acute malnutrition. I totally agree with what Charlotte said. But I heard your point of view. There are other products that are formulated differently, that are completely different, which are the SQLNS. And there is proof. There was an article published by the UNICEF that shows that there is an effect. But it is true that it would be an error to give RUTF to everybody. But I think everybody agrees about that. It was just a misunderstanding. Yes, I agree, but nobody does that. The RUTFs are limited to the most severe children who are suffering from malnutrition. We talk about prevention in Pakistan. So, no, prevention in Pakistan, we can clarify this, but it's not just with RUTF, it's a global approach. And the approach to prevent malnutrition in general, well, we have to base ourselves on local food. But the problem, as mentioned by Isabelle, is that there are many situations where parents, families, financially cannot afford to buy the food required to cover all the needs. It's very difficult to feed a child currently without animal produce. Animal produce costs a lot. And the HQLNS provide these nutrients.
Because I want to challenge my friend Saul. So we're good friends. We have good reason for that. I mean, a few years ago, there were very few people in the world who believed in RUTF. And Saul is one of them, Isabel, and as well, a few. So I want to challenge you regarding the sugar tax. You said once a tax comes into the government budget, it's very difficult to earmark it for a specific use. I will challenge you on that because I remember a few years ago, our president, Jacques Chirac, introduced a tax on airplanes specifically for paying for treatment for AIDS. So I think before saying, no, that's not possible, you should ask the opinion of the tax office in France. You know, we are one of the most highly taxed country in the world. So a very efficient tax agent, and I'm sure they will find you a solution. Another point as well is that this story which actually was about AIDS treatment. And I think we should get some inspiration as well for people who work on AIDS, because we never hear this discussion, oh, maybe we should spare the money we waste on treatment to prevent AIDS. AIDS is 100% preventable. We don't have this discussion. In my view, there is a big difference between AIDS and malnutrition, is that the people who are affected, those who are affected and who died 20 years ago from AIDS, there were people in the show business who were rich. Now the children who die, it's a severe acute malnutrition. They come from a very poor family with no political voice. I think if they had the voice, I'm sure they will find a way to earmark the tax on soda for our UTF. Thank you so much.
Yeah, I learned a long time ago that you got to do what Andrew says. So Unit 8 succeeded, it's true. And what they did is continues to be one of the best models of micro levies that I'm aware of that continues to reap rewards. When they transfer that to Unit Life with the extractive industries, which was for malnutrition, I don't know if there's anyone from Unit Life here. If there is, raise your hand because I don't want to misrepresent your work. But it didn't travel so well. My point about taxation is more when in that particular instance, I think what we have seen in some countries is a willingness to do the taxation, but I think that our ability as a sector to influence what the government does, they have the final word. That's what I was trying to say. We can advocate, we can make the case, we can help build the models, but at the end of the day, if the government decides to use that tax for something else, we have no control over that decision. So I think you're right. There are ways of doing this. They weren't taxing. There's an issue of jurisdiction there because I think that the deal with the IATA was an international arrangement, so it was a slightly different arrangement. But in any case, I think you're right, and I think you're also right about the HIV/AIDS experience and the fact that the prevention and treatment discourse, which is absolutely pointless in many ways when it comes to malnutrition, it would have been equally pointless with AIDS. I think the question that we have now is precisely why do we get into a fight even here? Here. How can we get into a fight here? If this room doesn't agree, how can we expect anybody on any of these boats to get behind us? They won't. They will say, you guys are bickering. When you figure out what you want, then ask me if you can have my support. But right now, figure yourselves out. So unless we find a way to solve this, because it's been a long time, right? If we cannot solve it in this room, until we solve it in this room, we shouldn't expect political support or public support. We should not. And the amazing thing is that every time we fight, we always arrive at the same thing. We're both right. Yes, that's the whole point. We're both right. And yet we feel compelled to make the point that a child shouldn't starve to death, or that our UTF shouldn't be used for prevention, or that prevention matters. Yet, evidently. So the question is, why are we still sucking at going out there and telling a story that makes everybody happy? In this room, I mean. I don't know.
Alors, pour les deux mots de la fin, peut-être.
So just to conclude, Dr. Rodrigue, if you have anything to add, and then we'll give the floor to Patrick Bernard for conclusion. So, Dr. Alitano, would you like to add something? Yes, well, this was a very fruitful discussion. We talked about a lot of developments. Yeah, this is the observation we're making in the field. The need to work on prevention especially in very vulnerable places. We talked about Sudan. That's the only country in the world where famine is present. We need to have a political engagement also, because as an organization, as humanitarians alone, we won't be able to fight this scourge. So political engagement means advocacy, bilateral discussions with the main countries that are testing all these problems. Speak the same language. Speak the same language. And you're right. We shouldn't just have a discourse that make everybody happy. We have to come up with specific resolutions that will benefit all the children suffering from malnutrition. And I would say that there's this need to obtain these funds that are necessary, as we discussed here, funds to ensure the continuity of our programs, funds to avail all these RUTFs and to take them, transport them where they're required. We all need to work together. We need to speak the same language. And even though politicians believe that it's just a band-aid, something that does not work, this will allow us to save lives. And a life has no price. So long as we can, we have to keep saving lives, and we have to continue in that direction. Thank you very much. Thank you. Patrick Bernard. First, I'd like to thank Patrick Bertrand. I'm in charge of Global Health Advocate. We are a political advocacy, and I've learned a lot in this session. And I'd like to thank the co-organizers, Alima, MSF, ENN, and the Eleanor Crook Foundation for this debate, for having been so frank and clear. That is what's so interesting in such debates. And what is clear among the panelists is that we need adequate and funds that we can anticipate. This is essential for treatment. We know the problem, the figures were given, and as an NGO of political advocacy, we have demands. We work on demands. And we have the summit that's going to begin on Thursday. It'll be on Thursday, Friday, with heads of states, with representatives, political leaders, and we have developed a whole series of demands that are political and financial. And the first thing is that, and this is obvious, but we have to remind our decision makers that nutrition and treating nutrition is a development priority. And that is not so clear for our decision makers. And malnutrition, as it was said in our debates, must not be considered as the result of a specific crisis, but it is a public health issue. We discussed this. And it is, nutrition is related to public health and development. Of course, we count on France's leadership that is going to host the summit at a time when we have these historical cuts for public aid to development in many countries, in many European countries, and especially in France, with a cut of 35%, which is historical. And there might be some other budgetary costs with the USAID crisis. And this might destroy years of progress. So we urge the players of development, the donors, to step in to guarantee to the millions of children receiving treatment to guarantee food. And the EU must show its leadership in this area. It showed it in the previous Nutrition for Growth summits, and we hope that it will be present now. And the World Bank, which is one of the greatest sources of funding for development in the world. And until today, the bank has given signals, but they aren't very clear. But as the civil society, as the French civil society, we have solutions. Earlier on, we talked about this. There's an article in La Croix signed by the partners of this meeting, and we talk about this tax on sodas, which is something very simple. In France, this tax on sodas, with an increase of just 1 cent per month, we could generate 82 million euros without any impact. So that's a simple solution. We have another solution, and we didn't mention this, but this is extremely important for France. Earlier on, we talked about the financial mechanisms as the tax on air tickets, which is a success, 7.6 billion euros since the beginning of this tax that has been received, which is huge. But in France, since 2012, we have a tax, which is the tax on financial transactions. And it is the tax that currently allows us to fund public aid for development. There's 1.9 billion euros per year with no impact on the financial sector, and more than 600 million euros for development that should be used to treat malnutrition. So we're working a lot with the French civil society to secure this tax with the MPs, with all the decision makers, and as Saul was saying earlier on, to be sure that this financing will reach the people who need to be treated. And we are working with the laws in the countries in France and in other countries. I'd like to end by saying that we're not the only ones. I'd just like to quote a very French survey, a poll that shows that in France, 70% of the French are in favor of maintaining or increasing the financial engagement of France to fight against malnutrition in the world. This is encouragement, and we're not the only ones in this debate. Thank you.
Merci beaucoup on va faire une pause avant la.
Thank you. We're going to take a break before the next round table, where we'll be talking about the solutions and innovative approaches to provide better treatment. So we will resume at 4 p.m. Thank you very much for your attention.